Humbled and privileged to be on the stage with you guys today. I was here last year presenting on how to translate pain science outside of and off of the treatment table. And today we're going to bring a little bit of a different vibe about healthcare burnout and about what it looks like and how you can protect yourself and things that you can do. So we're going to take this from the top, right? These are the objectives for today. Of course, they're too long and you didn't read. And what we're going to start with, though, is I told you, you didn't have to read them. We're just going to go through some stuff on burnout. We're going to look at prevalence. We're going to look at definitions. We're going to look at ways to fight it and what you can do about it, right? So that's the basis of our talk. But I'm going to start with my personal story. So if I get a little bit clamped, be patient. This is the first time I've ever shared this, right? And there's been a lot of open sharing. And so I felt drawn to do this. So yeah, this is me, right? I lived in Colorado, lived the Colorado lifestyle, Colorado state champion in triathlon in my age group. Of course, hold on, caveat, it was the Clydesdale category. I have to caveat that, so over 200 pounds. But I was fit, I did stuff. And then life happened, right? So I'm a second career PT. So before that, I was a personal trainer, worked in that zone as well. And then life happened. So I went to undergraduate school, PT school, residency, fellowship training, therapeutic pain science certification, and population health certification over the course of 10 and a half years, right? And then during those 10 and a half years, I got married. This is all simultaneously with school. Got married. My dad died of cancer. Moved across the country to a new state. A new career as a new fresh PT grad. My daughter was born. 3 months into my new job. 6 months in, I had my very own clinic to direct with 3 PTs. I'm a 6-month graduate. 3 PTs that are seasoned. I had 3 new interns that were there with me for a year that I had to teach how to be new PTs, right? I was teaching weekends, and I was still in fellowship with a new baby and a 3-hour commute. Yeah, almost 300 pounds later, all of my blood values were through the roof. I was drinking daily. I was drinking heavily on 2 to 3 days a week. I was eating as a coping mechanism. I was unavailable for my wife, my new daughter, my patients, myself. It sucked. It sucked. And so I consider, upon the reflection of the years and during that time in preparation for this course, is I was really burned out. And I didn't see it. I was in it, but I didn't see that. And so it's a really personal point to bring this to me. I didn't have the thoughts of suicide or the thoughts of suicidal ideation or hurting myself, but I was killing myself in other ways. And so the point of this talk, and to really bring this to you all, is that we all have our story, right? We all have how we cope, what our days look like, the stresses that we have, and how we manage them, and how we work through them. So let's talk a little bit about what it's like to start a fire and then burn out. Right? So let's do some definitions. So burnout, really, quite simply, is a state of emotional, physical, and mental exhaustion caused by excessive and prolonged stress. You can feel overwhelmed, you feel drained, and unable to meet the constant demands. I wish they made a burnout meter, right? You can wear it around and people can understand when you're about to burn out or not. But maybe that's a new app we can do. Anybody want to do that? We can start that. But there's also something unique called compassion fatigue. How many people feel compassion for their patients? Empathy. How many feel that, right? We are, as a whole, a group of body and mind workers, right? That's what we work on. We're not chemists of the body. We're physiologists, or not. We're not physiologists. We deal with movement. We're physicists of the human body and emotional. And so we all love empathy. We're the huggers of the medical society, right? We're the best huggers. PTs, massage therapists, we all like to hug. But you can have too much of that. And how do you cross the line? Or where do you see yourself in that engagement, right? So compassion fatigue is really the ability and listening and being a part of a patient's story, but also not able to separate. And so helping others that are suffering, to a degree, it can also cause you to suffer if you can't manage that relationship.